If you've already discovered lipedema, you'll find yourself wanting to stop people on the street and start talking about lipedema. I am Dr. Alexandre Amato, vascular surgeon at the Amato Institute. And today I'll talk about how to help someone you think might have lipedema. What can you do for this person? See, this situation of meeting someone on the street, thinking they have lipedema and wanting to stop and say something is extremely common. Imagine, with me. Walking on the beach, I see a lot of people I feel like stopping and saying something to. But we need to understand the context. We need to understand how this happens, when it can help and when it can hinder. So we end up helping people and not creating an awkward situation. So look, it's a highly prevalent disease. With 11% of women having the possibility of having lipedema, the chance of you bumping into someone on the street or meeting someone who might have it is really high. And if you stop people to start talking all the time, you'll realize that not everyone is seeking information about it. Why? Because lipedema is a cyclical disease. It has phases of worsening and improvement of symptoms. Many times people might even have lipedema and are not actively at that moment seeking help about that issue. If you start talking about it, it might seem like an invasion of privacy. So we need to understand where we are, who this person is, whether or not they are seeking information, and what we can or cannot share about it. I'll talk about this aspect now. So if the person is actively seeking help, then they are talking about it, they are asking. This is the best situation because the person has already realized they have a problem and they are wanting help. So you can offer all the information you have. You can share your experience, talk about who you know, what you recommend, but you need to make it very clear that bioindividuality, you need to understand that what works for one person doesn't work for another. So you can share your experience, and always with a caveat. Look, this worked for me, I'm doing well this way. I suggest getting an accurate diagnosis from a specialized doctor. I suggest specialized follow-up. If you want to try what I tried, feel free, but never present your truth as the truth for everyone. So you have to leave it open for the person to understand that. There are various ways to approach the problem. And maybe for them, it might be a bit different than it was for you. Encourage proper diagnosis, encourage physical exercise, encourage diet, encourage self-awareness. All of this is very good. The person is seeking help, share our channel, grab the link below, send it to them. It will definitely help. I have several videos about lipedema. It will surely open people's minds about the topic. Now, what if the person didn't ask? If the person didn't ask, they might or might not be looking for the information, or they aren't talking to you. They might even want to know, but they aren't talking to you about it. So what can we not do? Well, then we need to understand. You know this person, don't you? You do, but it's someone distant. So what strategies can we use to not be too invasive and end up not putting something that will disrupt the person's life? So if you know the person, you can share your story, share your experience. Who knows, they might identify with your story and might ask a bit more. And then it opens the possibility for a deeper conversation. Now, if you don't know the person, then it gets a bit harder, right? What business do you have approaching someone on the street and saying, look here, I think you have lipedema. People are not going to accept that calmly. We need to be more discreet. So it really depends on the context the person is in, right? If they're at work, on the job, someone you know a little, or is distant, you could leave a YouTube video open on a nearby computer. You could leave a printed paper discussing lipedema on the person's desk, or you could leave a website open if you share a computer in some way to raise awareness. Alternatively, you could, if you happen to know someone who is a bit further away, they might be on one of your social media platforms where you can share a post about lipedema, express your thoughts, and share your experiences. Make yourself available to talk about the subject. Sometimes you open someone's mind. I have here in the office a lot of patients who read or heard about lipedema for the first time on social media. They saw something there and then started to study the topic, and it opened up a range of opportunities. Now, this is much more delicate, right? How to help your doctor who doesn't know about lipedema, right? So be very careful. First of all, don't argue with your doctor because lipedema wasn't taught in the standard basic medical curriculum, simply because it was considered a less common disease. So when it was realized that the frequency was much higher, at least I teach about lipedema to my students at UNISA. I'm sure that in other colleges it's still not discussed, so there's no point in arguing. You will want to have people on your side. So I suggest bringing information, and the information for the doctor is a bit different from the information for the layperson, for the patient. So to convince the doctor, you'll need to bring some scientific work. You'll need to show evidence of this. So I'll leave here some links and some very serious articles about lipedema, and you can share them with your doctor if you want. And obviously you can also direct them to the website of the Brazilian Lipedema Association, which is www.lipedema.org.br, which is a non-profit organization that aims to disseminate both to lay people and to doctors thorough information about lipedema. And now, what can you do for the lipedema community so you can first participate in the communities? So there's a group on Facebook. I'll put a link below for the group as well. You can participate in scientific research. That's very good. The Brazilian Lipedema Association has a registry for you to make yourself available for anyone who wants to do research on the subject, and you can share your experiences both in these groups and on social media, helping to spread this information. Look, a lot of lipedema improves with healthy lifestyle habits. So encouraging others to adopt healthy lifestyle habits will only help. So share your experiences. That's great. Now be very careful not to approach someone who may have lipedema but isn't ready to receive this information. So someone who isn't thinking about this issue or who has already had many emotional problems because of it and ended up burying this whole problem deep in the back of their mind. Sometimes you might poke a wound who is not ready to be poked yet. So if the person is not seeking this information and if they are not prepared for it, maybe approaching this topic too directly could end up hurting them. It has to be done more indirectly, making yourself available, leaving the information more easily accessible. Did you like our video? Share it with your friends, especially with the one you think might have lipedema and needs a gentle nudge. Subscribe to our channel and see you next time.